The Free State registered 87 New Year's Day births, and Health MEC Montseng Tsiu is urging new mothers to ensure they breastfeed exclusively, at least for the first 6 months of their babies' lives. The MEC joins me now. MEC, very good afternoon and Happy New Year's to you. Now talk to us about this clarion call that you're making for these new mothers to breastfeed their babies.
Good afternoon to you, Hugo, and the viewers at home. Indeed, the reason why we are encouraging mothers to breastfeed is that we know that children that exclusively breastfeed, this is the results of a research that the WHO says if you breastfeed exclusively a child for at least 6 months, this child will grow well and will not be getting ill easier, like getting issues like diarrhea and other childhood illnesses. So we are encouraging mothers for their children to grow well without taking them to any doctor. Please exclusively breastfeed for at least 6 months before you can start with the solids.
Let me see, what are some of the factors that would contribute to mothers not breastfeeding their babies exclusively for this period?
Most mothers think that when you breastfeed a child would need water or something. But remember, the breast milk has everything. It has nutrients, it has water. That child does not get thirsty. Breast milk is enough to do everything. You don't need to give a child a bottle of water when you breastfeed. And sometimes mothers think that when you breastfeed a child does not get full just by breastfeeding. You need to give something else. And we know that breastfeeding is enough for the child. The child will not get constipated, the child will not get diarrhea, and you know that the breast milk is always at the right temperature. And sometimes mothers do not breastfeed because of not being able to know how to handle a baby when they have to breastfeed. So it is important that before we discharge mothers in the hospital, we teach them how to hold a child and how this child must grasp a breast in order to breastfeed. And the mother should be comfortable and the baby must be comfortable.
I'd imagine that many of these mothers could be first-time mothers. Now talk to us about some of those statistics. Any teenage mothers for the first time?
Yes, we do. In fact, yesterday when I arrived at Bongani Hospital, I visited Bongani. Those 4 mothers that delivered there, all of them were first-time mothers.
Were any of them teenage?
And there was also a 15-year-old that delivered at Boitumelo Hospital in Kroonstad.
Now, obviously, it raises the question of issues around teenage mothers, particularly when they are 15 years old. Is this something that you're following up to establish if the pregnancy was consensual, and what else could be, what other investigations would need to be carried out around the pregnancy and delivery of a mother who's only 15?
We have not as yet made any follow-ups as to who impregnated the teenager or and all that. But as we worked in our antenatal clinics, we have encouraged our nurses to take those particulars so that at least we work with social development and also we work with the police to try and find out who are the people that, if the sex was consensual or it was a rape or something like that. Because remember, as a 15-year-old, that can be regarded as a statutory rape because that child cannot give consent on the sexual intercourse.
So is it standard procedure that if a teenager gives birth, particularly if they are under 16, that an investigation is made or a report to the police is made when the birth occurs?
It isn't a standard procedure. It is just what we are discussing, that indeed we have been neglecting that. But since we now have children as young as 10 years giving birth, that is a concern to us. We have 14-year-olds giving birth, 10-year-old. I mean, the 10-year-old is still a child, but we do have mothers that deliver at 10 years, and that is a concern to us as the department. And we have seen that we can't do it alone as the Department of Health. We need to work together with the SAPS and even the parents, because a 10-year-old cannot give consent on the sexual intercourse.
You're absolutely right, MEC. Now, there is a report that 13 pregnant women at Pulinomi Regional Hospital were admitted into the hospital and had to sleep on the floor for a day or two. How accurate is this information?
I really I didn't get that information, but I can come back and check if there is such a report. I didn't get that report because as I went there I visited Pulinomi on the Christmas Day, and we had mothers that had delivered and those that were still waiting to deliver, but none of them were on the floor. And then on the New Year's Eve, I visited Bongani. None of them were floor beds. But one other thing, remember at the time when we had COVID-19, we increased beds, especially in these regional hospitals. So those beds and the lazy boys that we're using for COVID patients now help us if we happen to have a lot of mothers coming to deliver more than the space that we're having. We put them on those lazy boys and the extra beds that were used for COVID-19 because we don't have COVID patients anymore.
Now, one of the issues that's obviously been a thorn in the flesh has been that of measles, and there has been an outbreak reported at 5 provinces. Your province of the Free State, I think, has reported 5 cases of measles patients. How are you dealing with this in your province?
We are the measles. The only way to deal with measles is to make sure that all the children are vaccinated. What we are doing, we are using our community health care workers to check the under 5s at home that all the children are vaccinated. Those that are not vaccinated, we do a catch-up plan to make sure that we give them the vaccines that we give for the under 5s. That's how we can deal with the measles. We educate the community about the outbreak of measles and that they should bring the children as promptly as they can to our health facilities to get help. And so far, those 5 cases that we have, none of them demised. We're able to manage them. But because measles is contagious and can affect, can be passed from one patient to another, we encourage that mothers must take their children to our facilities to get the vaccines.
Now, finally, before we let you go, one of the conversations I've certainly had on the channel has been those that missed measles vaccination due to COVID-19. Are you making a deliberate efforts? I mean, you talk certainly about your health workers on the ground. Are they deliberately going out and encouraging those that might have missed this window during COVID-19 to get their children vaccinated?
We have not as yet started with the campaign of going to the mothers, to vaccinate them in the home. But I believe that that is what we need to do so that we're able to recover those that missed their vaccines during COVID-19. We are just encouraging mothers through the community radio stations to do through the any kind of media to tell them that as we talk in the media that mothers must take their children to the clinics for them to receive their measles vaccine, not just measles vaccine, but all the under 5 vaccines that we give to the children.
MEC, appreciate your time this afternoon.